Um, okay, everyone. Good morning, good afternoon, good evening, wherever you are in the world. It's great to be here. My name's Jacqui, and I'm going to be talking both personally and politically today about things that are really important to me. As many of you may know, I'm a survivor of organised, systematic, ritualised abuse that began when I was a baby and continued until I was 14 years old. And the consequences of that abuse was absolutely devastating. To be betrayed and exploited by the very people that were meant to be protecting me has left its lifelong legacy. And one of the ways that I've found meaning is through my work as an activist. About 4 years ago, I made the decision, it had been something that I planned for a really long time, was to actually try and get my main abuser, who was a public figure, prosecuted. And I embarked on a long and arduous and really painful journey of trying to get justice. That involved getting newspapers involved, working with journalists. I hired a private investigator and eventually gave 6 days of video testimony to the police force. I underwent doctor's examinations. I saw photographers that actually were able to document the consequences of torture that I was subjected to as a child that literally is carved onto my body. They were able to find other survivors because of the person that I'd employed, the detective, and they were able to interview other survivors. And the police believed me, even though the stories I told them were pretty mind-blowing. They believed me because there was corroborating evidence, both in terms of my own testimony and the testimony of other people. And as I said, there was literally evidence carved onto my body. And things were going quite well up until the point when they got my psychiatric notes. And I then received a phone call from a detective who I'd been working with to tell me that the Crown Prosecution Service had decided that they weren't going to proceed with my case because of the diagnosis that I'd been given. So one of the things that I found out is that all that abusers need to do is to fuck people up sufficiently that children then grow into adults who are so traumatized that they seek help from psychiatric services that will then write things on their records that will deprive them of justice. That was such a devastating discovery to me, and it's something that I've spent the past couple of years trying to come to terms with, and it's something that I probably will never accept because it's such a tremendous injustice. You know, what essentially we have is psychiatry as an institution colluding with the silencing and oppression of survivors of horrific abuse. What I want to try and do today, particularly at the end of this remarkable festival that Joe, or this part of the festival that Joe's put together for us, is to try and talk about, well, how do we antidote what happened to me and what has happened to so many people, as we've heard here today. And one of the things I want to try and hone in on is the importance of language. You know, part of what's so precious about Joe's work and the work of Lucy and lots of other people that I'm going to mention in my talk is the importance of paying attention to the language we use, because once we start turning very ordinary human responses to surviving devastating trauma into diagnoses, what we do is render those experiences meaningless and potentially give abusers and a whole load of other people ways to silence us. So it's really important to remember that names matter, language matters, and truth matters. So Einstein wrote a paper called Language and Mentality, and one of the things that he talked about in in that paper was that one of the things that colonizers did when they went and they colonized peoples was to remove their language. And it's a really effective way of changing the way that people think about themselves and other people think about them. So language and the language and the use of language, the words we use to describe people, is an insidious way of changing the way we think about people. So when we use medicalized language, it is a way of rendering intelligible things unintelligible, and that, I think, is a deliberate ploy that happens throughout psychiatry. I don't think it's accidental, and I'm going to talk about why that happens and the way that happens. So one of the things, and this is the kind of antidote part, one of the things that we can do as activists, survivors and practitioners, which is radical yet quite subtle, and in that way it's a bit of a Trojan horse, is to use ordinary human language to describe extraordinary human experiences. So this is a book that's been really key in my own recovery, Trauma and Recovery, by the brilliant feminist psychiatrist Judith Herman. The New York Times called it one of the most important psychiatric works to be published since Freud. I'm not sure if that's a compliment or not, but certainly it speaks to how seminal this book was almost 30 years ago now when it first came out, in really describing the ways in which trauma survivors are deeply affected by their experiences, but also what Herman was talking about was that the recovery, and I mean that in the broadest sense of the word, in that we are more than the bad things that happen to us, is possible. And what Judith Herman does in her book is she outlines a 3-step process for helping to help survivors to begin to recover from devastating experiences. And the first is to establish safety. The second is what she calls remembrance and mourning for what is lost. And the third is reconnecting with community and society. So within trauma and recovery, there's this really brilliant quote that Herman uses, which I use a lot in my work. And what she says is, the psychological distress symptoms of traumatized people simultaneously call attention to the existence of an unspeakable secret and deflect attention from it. This is most apparent in the way traumatized people alternate between feeling numb and reliving the event. So the dialectic of trauma gives rise to complicated, sometimes uncanny alterations of consciousness, which George Orwell, one of the committed truth tellers of our century, called doublethink, and which mental health professionals are searching for calm, precise language called dissociation. So doublethink, I mean, we live in times of classic doublethink. You know, I've been talking about doublethink for years, and I think we see it operating at such extraordinary levels now. It's become common parlance within our newspapers, mainstream media, talking about doublethink, even though many of them employ it themselves, of course. So it comes, of course, from George Orwell's book, and what it's describing is the act of ordinary people simultaneously accepting two mutually contradictory beliefs as correct, often in distinct social contexts. So somewhat related, but almost the opposite, is cognitive dissonance, where contradictory beliefs cause conflict in one's mind. And doublethink is notable due to the lack of cognitive dissonance. Thus, the person is completely unaware of any conflict or contradiction. So classically in George Orwell's brilliant book 1984, we have war is peace, freedom is slavery, ignorance is strength. So again, to underline, it is the opposite of cognitive dissonance because the person is unaware that there's any conflict or contradiction. And one of the things that I think happens is that this happens a lot in traditional psychiatric settings. I noticed a psychiatrist putting in the chat earlier, please be kind. Remember, there's good psychiatrists here, and of course there are. But what I'd say to that psychiatrist is that we're not talking about you as an individual. We're talking about a system that operates within our society that causes people a lot of harm. It caused me a lot of harm when I was a young woman, traumatized and trying to be heard and speaking about terrible things that happened to me when I was a young mother. And it's caused me a lot of harm many years later when the very people that have abused me and many, many other people have effectively gotten away with it because of this thing called doublethink. So I would argue that psychiatric terminology is in itself a very powerful form of doublethink, and here's why. Because it enables this clinical assessment through its very special, affected, as Lucy would say, reified language, which creates this illusion, and I would argue a delusion, of neutral objectivity. Joe began today with this great quote from Sami Tamimi, one of the good guys, and he says that what diagnosis is subjective opinion masquerading as fact. And this is one of the problems, and we've talked about this. It's been a theme throughout the day that what we have is in effect the operation of power. Because it's not just anyone's subjective opinion, it's somebody in a position of power who has a lot of power within the system that they're operating, but also they have statutory power. They have the power to force you to take medication that you don't want to do, to impose diagnostic labels on you that may be meaningless to you, and to deprive you of liberty. And as I've described, a whole load of other really devastating consequences. So what this kind of terminology does very effectively is it invalidates, it mystifies, and it renders unintelligible really normal human reactions to abnormal circumstances. And consequently, it facilitates this decontextualizing, because suddenly we're not thinking about children that are being raped and abused and terrified and betrayed. What we're thinking about is the language of disorder and psychosis and schizophrenia and personality disorders and all of that stuff. And again, there's lots of research out there shows that actually psychiatric diagnoses actually reduce understanding, they reduce empathy, and they increase stigma. So they increase distancing, they diminish the suffering, the real suffering that is often at the root cause of what causes people to be so distressed and crazy in the first place. And they facilitate the denial of devastating experiences. So hence the Crown Prosecution Service can say, well, we're not going to prosecute this person that has abused hundreds of children, and you know, consequently, many people have taken their own lives. Many people's lives have been completely fucked up and destroyed as a consequence because they all have a psychiatric diagnosis. So it completely diminishes and denies these devastating experiences. And effectively what it does is it results in collusion and complicity. And it focuses on the deficits of people like me. As you can see, I'm really deficient. Rather than on the injustices of perpetrators. And this is one of the big problems, that we, in focusing on the deficits of people and on pathologizing individuals, we fail to look at the much broader context and the innumerable injustice perpetrated by many, many people. And when we talk about perpetrators of injustice, it's important to say this extends beyond perpetration of child abuse. As we know, looking at the numerous studies that exist, there are many social causes for serious mental, for people feeling really disturbed, despairing, and frightened, and a whole load of very ordinary ways that people respond to devastating things that happen to them. So things like child abuse and neglect, school and workplace bullying, domestic and sexual violence, discrimination, poverty and unemployment, events which involve relatively powerful groups, so governments, corporations, men, white people, adults, damaging less powerful groups. So in the case of emotional distress, then context seems to include or even to equate to the operation of power. This, of course, comes from the brilliant Mary Boyle, one of the main authors of the power threat meaning framework, along with Lucy. And of course, on top of this operation of power, which happens in multiple ways, then the kind of the cherry on the cake, the final insult to injury is diagnosis. So diagnosing someone with schizophrenia, and in fact you could replace pretty much any diagnosis there, but I'm quoting Lucy here, and we're talking about schizophrenia, is one of the most damaging things one human being can do to another. Redefining someone's reality for them is the most insidious and most devastating form of power we can use. And in that, we have the heart of what is doublethink. Because, of course, the knowledge of horrible events periodically intrude into public awareness, but they are rarely retained for long. So denial, repression, and dissociation operate on both a social as well as an individual level. And this is one of the things, I talked about this earlier, that what we see happening within the psychiatric system is a microcosm of what is happening in a much wider system. And it's really important to hold on to this, that we as a society have put psychiatry there to deal with people that are distressed and distressing to us. Psychiatry is doing its job, and psychiatry won't change until society changes. And until people really get to grips with that, I think we've got a long way to go. So what is to be done? I'd like to try and end on an optimistic note, although I'm not feeling necessarily that optimistic myself at the moment. What is to be done in the face of such tremendous multifactorial vested interest in sustaining a biomedical model of human misery and madness, with its function of pathologizing and decontextualizing human distress? It is natural to despair, rage, and feel impotent to effect change. And I think it's important to have times when we allow ourselves to feel that, it's true, it's honest, as long as we don't get stuck there. And one of the things I want to try and do now is think about, well, in the face of these tremendous multifactorial vested interests in sustaining a biomedical model, and there are, we have individuals, we have families, we have mental health services, we have societies, we have politicians who are only interested in, getting voted in, often in the next 4 or 5 years. None of them are really interested in profound change. And then, of course, we have Big Pharma that is making tremendous profits and keeps inventing new disorders and diagnoses so that more and more people can be prescribed medications that they can make a profit from. So what can be done? Well, gathering today is a really important antidote to that. It's nourishing to me, and to be reminded of why it's important to keep fighting. Much of the work around human rights, and this is a human rights issue, one of the things that I and other people have been saying for a long time is that fighting for the rights of those of us that have been labelled mentally ill is one of the last great human rights battles. And much of the work around human rights begins with accurately and aggressively reframing the status quo as an outrage. What happened to me and the other survivors that were abused alongside me was an outrage. What happened to Sarah and other people is an outrage. And I know that there'll be hundreds of people listening today that have experienced outrages, who are suffering quietly. And one of the things we need to do is not be so quiet anymore. And we need to actually stop changing the language that we use, because once you change the language, you've begun to change the reality, or at least to begin to open the status quo up to question. So what protects an outrage are disguises, circumlocutions, and euphemisms like psychiatric diagnoses. This is from the work of Rebecca Solnit, who Gabor Mate, or I think it was Johann Hari mentioned earlier, a really brilliant environmental activist. and she's done some brilliant work looking at the importance of reclaiming language in terms of the war on terror. So, for example, this was, terms coined by the American government, enhanced interrogation techniques, as a euphemism for torture, collateral damage, for a euphemism for killing civilians, the war on terror, the war against you, me, and our civil liberties and human rights. That's from a really brilliant article by Rebecca Solnit, Words are the Greatest Weapon for Political Activists. So what does this mean within a psychiatric setting? Well, as I said, it really means just saying as it is, and returning to everyday, ordinary language as a kind of powerful antidote and remedy to sorry, I'm having a problem on my slide, as a powerful antidote to the silencing that is enabled because of psychiatric diagnosis. There's a whole list of things that we can do in our daily practice to subvert the status quo, deconstruct biomedical model and the traditional relationship of dominant expert clinician and passive recipient patient. So actually challenging this power imbalance and actually sharing power both in the room with people but in much wider contexts. So in terms of what we consider expertise, broadening out, John Reed, Lucy Johnston, there are a whole load of professionals. I'm a professional, but that I've worked alongside with for many years that don't patronisingly invite me to belong to projects, but that and people like Sarah and other people, but really value our work, and it isn't in this kind of patronising way, but know that we know because we've been there and we've got something really important to offer. So changing that dynamic, and that means sharing power, advocating and practicing mutually respectful collaborations between experts by experience and experts by profession. So events like this, in terms of research, in terms of delivery of service across the board. And again, I haven't got time to go into it, but not employing peers because it's cheaper and not to tick boxes, but actually because we know that people who've lived through profound and extreme experiences know what it's like to survive those experiences. It means that as practitioners, being brave, taking a stand, having the courage to bear witness, which is a profoundly difficult thing to do. Just sit and listen to some of the things that I and other people experience is devastating. And it means being able to name taboos, to not hide behind the language of auditory or sensory hallucinations, but actually to talk in detail about the awful things that people are remembering and describing, to describe injustices and outrages. It means to stop using scientifically meaningless words, stigmatizing words that focus on deficit and chronicity, words like schizophrenia and bipolar and personality disorder, and medicalizing terms like mental illness and symptoms. So it means reframing and reclaiming ordinary language that restores meaning and context. Context is all important, which is firmly rooted in people's lived subjective experiences. It means ensuring service users, survivors are involved in the management of and training of mental health services. It means asking service users about their past and how they think about what's happened to them, and rejecting this tired old fallacy of the can of worms. The amount of times I've heard practitioners say, I'm frightened of asking about what's happened to this person because I don't want to open the can of worms. Trust me, if somebody is in psychiatric services, then the can of worms is well and truly fucking open. And actually medicating people, giving them ECT, all you are doing is subjecting a person to a lifetime of being frozen with the can of worms well and truly spilled open, and no way of actually speaking in a meaningful way. This is a healing opportunity. You know, when people pitch up in services, they're in crisis, and this is a healing opportunity. And it is their human right to have that opportunity to heal from the devastating things that have happened to them. And
Jacqui, I've just given the 5-minute warning.
Thank you so much, John.
Yes,
so what that means is that if you are somebody who's here, you're probably part of the choir that I'm preaching to. So what that means is helping your colleagues to focus on recovery, not pathology. It's important to remember you cannot do this on your own. None of us can. You know, it's a very lonely business. And that's why colleagues like John and Lucy and Mary and my friend Elaine, who's listening, and lots of other people that are here today, Olga and other people across the world, those allies are precious, because when I'm standing in front of a group of psychiatrists saying things that I know they're not going to want to hear, I can hold in mind my colleagues and my friends that I know standing by me, even in my imagination. It means forming alliances between progressive professional organisations and groups of service users, survivors and family groups. You know, all of us that are trying to bring about change, we need to do that together. And if you as a person, if you need to use services and your diagnosis for whatever reason, you know, because you need the support, you need the welfare benefits, you need the passport of diagnosis to open certain doors, you know, let's be pragmatic, fine. But don't buy their version of your reality. Don't buy the bullshit. Know your own truth. Define your own reality. Do not let anyone else define your reality for you. My final thought, legitimi non carborundum, or to just say it as it is, don't let the bastards grind you down. Thanks for listening, everyone.